Hey everybody, I'm Dr. Rocco, Springs Family Chiropractic here in Colorado Springs for a great patient video of the week. I want to talk to you about an amazing therapy that you can get as a patient. If you have pinched nerves, scoliosis, bulging discs, herniated discs, or you're having a really hard time with motion in your back or neck, this is your solution. This is called decompression therapy. What I'm sitting on is a decompression table. It's also known in the physical therapy world as traction. Okay? You can use this for your neck or your low back. Now, we have ligaments that surround our spine, our spinal column in our neck and our back all the way down. 9 ligaments in total connect each bone to each bone. Okay? This gives stability and support. These ligaments also stabilize the structure so that if bones shift out of place, your spinal cord does not get severed, because if it got severed, we'd get paralyzed or lose our survival ability. Okay? We'll lose all of our oxygen, blood, and energy control to all of our organs and muscles. So, here's the deal. A lot of times people get into a car accident. Okay? We're going to say you have whiplash. Okay? We're going to say you get hit from the side. This is Mr. Spine, our friend. So he got hit from the side. Bam. His head's bent over. He comes in with a twist or bend in his neck. This is really called scoliosis. It's functional scoliosis. That means you acquire it from physical, chemical, or emotional stress. It's sudden and sometimes reoccurring. Okay? Yeah, you could have multiple car accidents. Well, anyways, in this case, one accident. Head's bent, there's a twist, head's going the other way, neck's going one way, and head's going the other. So, what we can do with this table, this decompression table, is we have patients lay down, and the table applies resistance forces into the spine. Okay, it does it 30 seconds of resistance, 30 seconds of relaxation. This allows us to reshape the spine. Get it back into its correct natural position, get ligaments that are getting pinched and deformed to be reshaped, just like dentists do on teeth with braces. This is traction. It takes multiple times to reshape areas, just like braces do on teeth. Okay? So an individual would literally lay down here. There's a headpiece here that they would lay down and they would put their head in. Okay? I'm going to show you on myself because this table is completely different than an inversion table. Okay, inversion tables do resistance onto your knees, your ankles, your hips. They do not and they cannot do what these tables do. Okay, so I'm going to put Mr. Spine down on the ground. I want to show you guys. Okay, this is a basic headpiece. We can adjust this table on its height and its angles. Let me show you real quick. Lift this up. I can lift it up so I can change the angle. So this means if a person has a hard time with headaches and problems right at the tip of the top of their neck where their head is, we can address this. So a patient would just lay down, bam, they put their head right here on the bumpers, and the strap goes over their head. Okay? And then we connect the cable and forces begin to pull on their neck, applying it to reshape the ligaments. This is a pretty simple therapy. This is not something new that just came out. It's been out for about 30 years. Very few doctors use this, but it gives us maximal results. Now, I'm going to have you come back in a second, and I'm going to show you what we do for the low back, injuries, herniations, bulges for the low back. Okay, we can also do this in the neck, but I'm going to show you so it's a little easier to visually comprehend. Okay, so I'll see you in a second. Hey everybody, Dr. Rocco again. I'm back here with you, part 2. We're talking about decompression therapy for your neck and your spine. This time, I'm going to show you what we can do for the low back. Okay, so here's the scoop. Here's my friend Mr. Spine again, all right? Between all your bones in your spine, you have these discs that are between each bone. These discs are mostly cartilage. On the inside, there's a gel. The gel is mostly water, okay? These discs are like shock absorbers. Think of a hydraulic. It goes up and down, up and down. So anytime you walk, you run, you jump, these discs get squeezed and then they expand. Squeeze and expand. Now, we'll say you have a trip and fall and these bones, they just get shifted out of place. Your pelvis gets tweaked and rotated. Well, those discs also allow spaces and gaps between each bone for the nerves to come out. When the nerves come out, they're going to go to the whole body, all the organs, muscles, and cells. Okay, this is controlling oxygen, blood, and energy. Now, if you have a bone that goes out of place, this can pinch your nerves. Hence, why do I have a pinched nerve? Or maybe, I don't know what's wrong with my back, I can't move, the muscles are spasming, I can't bend over, touch my toes, I'm losing circulation in my foot is cold, my legs are giving out on me, or I'm feeling weak, or I'm having digestion issues, urination issues, all of the above. Okay, so spine is supposed to be straight up and down from behind when you look at it. If you have an accident, trip or fall, car accident, it might get bent. We're going to say it gets bent and rotated. Okay? So, we want to correct that because all these bones, the discs are getting messed up, the nerves are getting pinched. This will become arthritis. This is a guarantee. This isn't something that you got from your grandmother. This isn't genetics. This isn't about stress or age or gender. This is pure mechanics, okay? Every day, gravity is pushing down on your body 9.8 pounds per square inch. So if these bones and discs and ligaments are not lined up, they wear down. They get worse, they get weak, they get unstable. So what we would do is we would have Mr. Spine lay down on the table. Feet are where I am. Head is up there. There's straps on these tables. The straps go around people so we can isolate the area that we're specifically working on. Now, I'm going to show you too, this table, when I stand up and I show you, look, it separates. Why? It separates so we can allow the joints and ligaments to be reshaped and gap. We have to gap the joints to allow it to be reshapen and give space for these nerves between these bones to get decompressed. Because right now they're getting pinched, okay? So let's show you on me. I put Mr. Spine down on the ground. I'm laying down. I would just have my knees bent or legs down, and I would just put the straps on, okay? And then they hook up a strap, a cable, to the machine, and it hooks onto another belt that I have here, right here, with straps on. And then all we do is we commence the protocol of adding resistance and traction. That's pounds of pressure, about 75 pounds of pressure that we have to build up to deform and change the shape of the ligaments. This is going to give you your highest success rate on assisting you to correct, restore, regenerate, heal your herniated bulge discs. You also have to do other things too. This decompression therapy here that I'm sitting on is going to give you a 50-50 shot. You have to do other things like hydrate, drink water, half your body weight in water. You also have to get some chiropractic manipulations. That's going to be your best protocols to restore your spine and get you back on track to get your health, okay? If you need some help, give us a call. We'll schedule you an appointment. You can come in and do an initial trial. Look us up online on Facebook and YouTube for some of our other patient videos, okay? I'm Dr. Rocco at Springs Family Chiropractic.